I'm David Mason. I'm the Director of Public Health, and this is Public Service Announcement number 12. Today, I'm excited to have with us is Joanne Gake. She is the public health nurse for the town of Sandwich. So we're going to have a conversation with her, but as usual, we're going to start with Chief Burke with an update on our coronavirus status.
Thank you, Dave. The numbers as of today, the 23rd of April, 6 positive. We have 49 recoveries and 2 deaths. So we're still trending in the positive direction. 3 residents still hospitalized, all in stable condition. And again, the age range was roughly 21 to 92.
Very good. So we are going in a great direction because of the work that people out there are doing. And to talk about that work is we have Joanne Gake today. We're starting with Joanne. She is our superhero in Sandwich here because of the efforts and the work she is doing. Her compassion and her commitment is unbelievable, and we're greatly appreciative of her work. We don't have a lot of people here, so cue the clapping. Okay, turn off the clapping now. Thank you very much. Joanne is the person that you want to know because of her background, the work that she does, but at the same time, you don't want to know her. And I mean that in a serious way, and humorous. But as far as when you get a call from her, or if you get a call from her, it's not the call you want because it means you weren't doing your part to control this virus. I'm going to kind of throw that out there. But anyways, because Joanne wanted me to point out that people, that what upsets her most is when people don't call her or follow the guidelines. So we'll have a conversation about that. So Joanne, as far as when we go forward, welcome here. So how does the public health nurse learn about a positive case?
All right. It's not unlike what I do every day for other surveillance cases. I go into Maven, which is the Health and Human Services website, and look at the data, and I'll see a little section that says immediate disease notification. In this day and age, I know it's COVID, and I call the people right away, and sometimes I'm the first person they've spoken with regarding the positive culture, so it could be a shock. But obviously, most of them have had symptoms, so they know that they might be positive. The information that I get on Maven about them is their name, their birth date, their address, sometimes their phone number, and a culture report. So I look at the culture report right away to see when they were tested and, make sure that it really is positive. Now, when I speak to these people, what I want to know initially is what their symptoms are and the date their symptoms began. And the reason for that is I count back 2 more days, and that's when I start looking at the contacts that I will need to be getting in touch with. As far as symptoms, that's mainly for CDC and Department of Public Health, and the symptoms range from shortness of breath, fever, cough, headache, loss of taste, loss of smell, sometimes GI symptoms, but they're all over the place right now. But it seems like there are a lot of headaches and myalgias, and not so many shortness of breath, although that is probably one of the more important symptoms.
Okay, because let's just back up for a minute too. So when you get notification, that is directly from the Mass Department of Public Health. Because technically that goes from your doctor or your testing.
It goes from the labs to the main lab at Department of Public Health, and then they kind of parse it out to the different towns. Whoever is from Sandwich will be sent to me.
Right, so in that information, because you mentioned that you receive their name and their address, but that's not public information.
Correct.
Because basically you're covered by HIPAA regulations, so that information's protected. And because as we've gone along, so you speak with those individuals, and when you contact those individuals, what is the conversation you have with them?
I guess initially I try to let them talk, about their disease and how they've been feeling, what brought them to the doctor in the first place. Some of them are really concerned that the information will be out there and all their neighbors will know they're positive. And it never comes from us. If it does get out there, it's usually they have told someone or they go on Facebook.
Right.
But, and the next thing is I go over the isolation with the patient and explain that if they're able to have their own bedroom and their own bathroom, then that's really good. Sometimes it doesn't happen if you have a large family. And in those cases, you can almost always expect the whole family will eventually get the virus. Although the family won't be counted into the numbers because they never have a culture for the most part. They're not.
So when you reach these people, also these people that are positive cases, you're also contacting them to determine. A lot of people have heard the term contact tracing. And can you explain that?
Yes. So I look at who they've been in close contact with 2 days before their symptoms, up until the time I'm speaking with them. And close contact would probably be any family member. It would be anyone who comes over to visit, like grandparents, aunts and uncles, friends that come over to visit. So they're within 6 feet distance of the person, and they don't have a mask on, and it's over a period of 15 minutes or greater. It would mean any place where you work, the whole workforce are potential, contacts if in fact you were close with them or sitting in an office perhaps for, an hour or more.
Right.
And then I need the information on the contacts as far as date of birth, phone number, address, and then I'll get in touch with the contacts.
Yep. So we end up, and you end up reaching out to the contacts to put them to quarantine them.
Yes.
Isolation is for the positive person.
Correct.
Quarantine is for those contacts at this point, right? And some of those contacts are in other towns also.
Yeah, and I like that because when they're in other towns, then there's a place in Maven where I can connect them to the Board of Health in that town, then that town becomes responsible for monitoring them.
Right.
But what I always try to do is get to them first and put them in quarantine.
Right.
So that they're not out and about at the grocery store, at the pharmacy, before they know they're going to go into quarantine.
So when you make a call and people receive the call, because we've had some situations that we've had to go out and knock on doors because people haven't returned the call. Why is it important to return the call?
Well, as soon as I can put people in isolation or in quarantine, the better off we all are. We're trying to mitigate the effects of this virus. And everybody who's out there with the virus is in touch with usually 2 to 4 people that then become, contagious with the virus. So we're doing the best we can. A lot of people are asymptomatic. There's not much we can do about that, but whoever we know has been in contact with a positive case, we want to get them quarantined.
So let's walk through a positive case then, because we had a situation just over the weekend. We had I'm aware that a lot of people are familiar with what went on at Cape Heritage Nursing Home. We had a positive employee that was there, and you reached out to that positive employee, and what did you find out? What was the...
That positive employee was, I think it was probably by the patient's physician, was already told to stay out of work and to isolate. And what I did is I spoke with the director of the facility, and we discussed what the next step should be. And that was talking to all of the staff and letting them know, and also looking for symptoms in the staff, and talking to them. Because what we want them to do is, if they have any of the symptoms, is to stay home or go home, and we can deal with them from home.
Right, so that's to control the situation,
Right.
to control the spread of the virus, but we took additional steps there with the cooperation of Cape Heritage and Chief Burke, as far as you have some ideas on what occurred there. People saw what was going on with the National Guard, or some people saw what was going on with the National Guard yesterday.
Yep, so we were prepared for this a month or two ago when the Guard came out with a protocol, and we've worked with the guard in the past. In fact, our drive-through in 2009, we had worked with the same medical detachment that's in the nursing home. As soon as we found out Saturday, Dave called, we spoke with the facility, and we put that immediately into action. We thought it was the proactive step, even though it was one employee and not resident. We thought it was the right thing to do. The guard was very responsive. Cape Heritage is very responsive. We had them there yesterday. I know it looked like an army when they show up, but they saturated the building and were done in 2 hours. They ended up doing 212 tests, which is a huge amount. More than 60% were staff, 40% were residents there. We should get the results back shortly, but I think it's important, and Joanne can add to this, that if you're a patient there and you live in the town of Dennis and you end up being positive, the town of Dennis is notified and counts as a number for the town of Dennis for a positive case.
Right.
So I think that's important for people to understand. And again, the folks at Cape Heritage have been working with us for the last 45 days with daily reports of bed counts, working with them on PPE, just having an open line of communication. So I think having the team together and working with them in advance, we were able to really expedite the testing within 72 hours of a positive case, where the average time frame is 10 days. And within 3 or 4 days, we had the guard in there and doing the testing. We should get the results shortly.
Very good, because I wanted to add that in, because I knew there were a lot of questions when you saw the National Guard show up all suited up, and pictures were on social media, just so people have an understanding. One, we're aware of it. 2, controls were put in place. Joanne's been in touch with them from the beginning and has been monitoring that situation daily at this point. So so just as going through this process, Joanne, what's it mean to be a direct contact? What is that?
A direct contact would be if you were in an office and your colleague was sharing the same office with you all day, that's a direct contact. If you had a conversation at the door with someone who was within the 6-foot distance for 15 minutes, that's a direct contact. So anybody that, has spent time with you or has spent close time with you is a direct contact.
Very good. And as far as then, those contacts, what is so important about isolation? What is the purpose of that?
The faster we can get these people in quarantine, the contacts, the better it is for those of us around the community, well, at this point we have masks, but the safer it is for those of us in the community, because we want to lessen the ability of the person with the potential virus to be in contact with somebody else and continue the spread of the virus.
If someone felt they felt they had been in contact with a positive case or a direct contact, what should they do?
And I get those calls every day. If someone feels they've been in direct contact, first of all, they need to quarantine themselves for at least a couple of days until we can trace back to the patient to see how close the contact was. Also, if someone is not feeling well, they should quarantine themselves for a couple of days until they can see if, in fact, they're sick, or they need to call their doctor, they need to have a swab done. So the better part of valor is just stay away from the public for a couple of days, until we can get the situation straightened out.
What message do you have for everyone out there? I mean, we're talking about questions as far as what your experience is and protocol and everything. What's your message to the people, to the community?
Right, stay home if you're sick is the first one. You don't know how many times I've talked to people and they have been sick all day, they've gone to work, they then do their grocery shopping, and then they go home, and already they've been in close contact with a lot of people, and it's almost impossible to trace some of these people. So that's number one. And number two, if they hear from me, if they could answer the phone, even if they might not have it on their list, I'd appreciate it, because it takes a lot of time going back and forth trying to get in touch with these people. And it concerns me. The longer it takes me to get these people out of the public place, the better off we are.
Okay, because, and I know Joanne's very passionate about that, because as far as reaching out, she wants to see this virus get under control, and it is that these steps or measures that we're taking are intended to do that. So it's frustrating for her when she can't reach out or people aren't cooperative, because we're observing that. I mean, Joanne right now is going 24/7. She's up early in the morning, late at night, as far as 7 days a week at this point. So we don't need to make her job any harder as it is. She's trying to get things under wraps here. She's doing a great job of it. She's very compassionate, spends time on the phone with people following up on their illness. And we need to make her job easier. At the same time, the work we're doing is to control the resources that are utilized for responding to this with Chief Burke's people. We don't want to put those people in harm's way. Actions that you take have consequences. And if you are not thinking about the people around you and how to behave and using a facial covering, you are making life harder for other people. You're utilizing resources and putting families. Chief Burke's people have families. They're getting, they're in exposure. They're using PPE, but it's just one step that's not necessary. If you can think about your actions and how they affect others, we can limit this virus also. Anything else you want to add?
I think if people could understand that some of the residents of our town have been on ventilators in the hospital for weeks, because it takes these patients a long time to recover their lung function. But besides that, their loved ones are home isolated with the virus as well. So the people in the hospital have nobody to go visit them because they can't. The person at home has nobody that can come into the house and talk with them because they're suffering too. And it's very, very difficult for people. It's also difficult for some of our older citizens because they're in their apartments by themselves and nobody can come in and talk to them. They're positive. So the good thing that we have in this town, we make sure they have groceries, they have the food that they want, they have the medication that they need, and we keep in touch with them almost daily to make sure that they're not any worse. We notify each other if we think that there's going to be a problem, so we're ready to take care of that particular person. But there's a lot that goes on, I think, that people don't see. What they see and hear about are those people that have the virus that are feeling good. I just have a runny nose and a headache, but I'm feeling good. Well, there's a lot more out there than those patients, so just be aware of that.
Very good. No, thank you very much, Joanne. Chief Burke, anything you want to follow up on with regards
No, just
to your...
again, to echo Joanne's work. I mean, people need to understand that she's doing the work of 10 people as one, and the communication, I think, is important. We have that relationship where I can text her at 9 o'clock and say, put this on your radar. We transported this particular address. It may be something, and she's able to follow up on it and keep us informed, and also advise me as a chief with my own people. If I have a question on a contact or an exposure or a family member, she's right there to answer it. So I think we're very, very lucky to have her in that position. She's also a BU grad, as am I, so I'm going to throw that out there also. But, again, it's just excellent job, Joanne, and heed her advice. Don't make her job more difficult than it already is.
So this is 3 members of the COVID team that are asking you, make our jobs easier. Use a facial covering and be considerate of your neighbors. Be safe.